How does sexual orientation impact LGBTQ plus health? Have you ever wondered how sexual orientation affects health outcomes for LGBTQ plus individuals? It's a complex issue influenced by various factors, including social stigma, discrimination, and healthcare access. These elements create significant health disparities when compared to heterosexual and cisgender populations. LGBTQ plus individuals often encounter stigma and discrimination in healthcare settings. This can lead to a reluctance to seek medical care due to fears of mistreatment. When people avoid health care, they increase their risk of having untreated sexually transmitted infections and other health issues. Research shows that transgender and bisexual individuals report higher levels of discrimination, which worsens these health disparities. Mental health is another critical area where LGBTQ plus individuals face challenges. Studies indicate that they experience higher rates of depression, anxiety, and suicidal thoughts compared to their heterosexual peers. This is particularly true for bisexual and transgender individuals. The stress from societal stigma and discrimination, often referred to as minority stress, plays a significant role in these mental health issues. For transgender and gender-diverse individuals, gender-affirming medical care, such as hormone therapy and surgeries, can greatly improve mental health outcomes. These treatments can reduce feelings of depression and suicidality while enhancing overall quality of life. However, access to this type of care is often limited due to discriminatory policies and insurance coverage issues, which directly affect health outcomes. Social determinants of health, like economic insecurity and social isolation, further complicate the health landscape for LGBTQ plus populations. For instance, higher poverty rates among transgender and bisexual individuals can limit their access to health care, making them more vulnerable to poor health outcomes. When we look at sexual health and sexually transmitted infections, these disparities become evident. LGBTQ plus individuals may face increased vulnerability to infections due to barriers in accessing culturally competent sexual health education and preventive services. Fear of discrimination can prevent them from seeking testing and treatment for sexually transmitted infections, which can lead to higher transmission rates and complications. In summary, sexual orientation significantly impacts LGBTQ plus health by shaping experiences of stigma, discrimination, and access to affirming health care. These experiences influence mental health, sexual health, and overall well-being. To address these disparities, we need inclusive healthcare practices, non-discriminatory policies, and targeted interventions aimed at improving access and reducing stigma within healthcare systems. Always remember, if you have health concerns, it is important to consult a healthcare professional for personalized advice.